Welcome everyone to Innocast. I'm Jonathan Fritz. I'm the Chief Innovation Officer at Chime. For those viewing live, we're excited to have you join us today. And for those viewing on demand, welcome. A special thank you to our leading supporters, ClearSense and Medtronic. I'd like to start with why. Why did we launch this program? Quite frankly, most hospitals aren't set up to engage with nimble startup companies, and most startups don't know how to partner with those hospitals. However, COVID-19 has changed that game. Now, hospital executives see what is possible and how to quickly and effectively solve problems through removing roadblocks. It's these roadblocks that we see and want to try and avoid to solve problems through a creative process. As a startup investor and a recovering patent and venture capital attorney, I'm keenly aware of this problem. Simply put, we want to highlight innovation between health systems and startups. This program is all about real problems faced by hospital leaders and how they solve them in partnership with emerging technology companies. Today, we're focusing on the partnership between Memorial Healthcare System and Intelligent Observation. I'd like to give a special thank you to our speakers, Jeff Sturman, SVP and CIO of Memorial Care Healthcare System, Seth Friedman, CEO of Intelligent Observation, and Jesus Diaz, Director, Nursing Informatics at Memorial Healthcare System. They will be talking about the preventable HAIs and automated process for capturing all hand washing events. Time permitting, we're going to take a couple of questions at the end, so please submit any questions in the Q&A tab. As a reminder, we have an exclusive Q&A session for Chime provider members only. Members are welcome to join the special behind the scenes session immediately following this webinar. The session is going to be moderated by Chad Brizendine, the CIO at St. Luke's University Health Network. And I'd like to also let you know that if you have any questions or if there are any issues with this presentation or with the Zoom meeting, feel free to send a message in the chat or send an email to Christy Kenyon. And also for members, if you're having problems entering into the Q&A session afterwards, please feel free to message Christy as well. For those that are looking to view this after the fact, we will have this on our website, and so you'll be able to do that on demand viewing. So I'd like to once again welcome Jeff, Seth, and Jesus. Please take it away.
Good morning, everyone. Jonathan, thank you so much. Jesus, I'll let you share your screen here in a moment, or actually you can start that now. But welcome everyone, and thank you for the opportunity to talk to you this morning. I hope you're all doing well, and before we get started, I would be remiss if I didn't reinforce probably some of what Jonathan just said. And in the face of COVID, this last year has been just unreal for all of us. And thank you for everything that everyone has done here. I know, like my healthcare system and probably all of you listening to this right now, we've really risen to the occasion and really used technology to leap over facilities and create new access mechanisms and create really innovative ways to deliver care. And, I know for my world that we all live in, I certainly feel like I'm part of that care delivery process more than ever. So really just a point of off comment, off color, but thank you to everyone. I'm going to go into a little bit about Memorial Healthcare System, who we are, just for context. We're going to talk about the problem we were trying to address, which Jonathan really laid out there already for us, and part of the solution. So Jesus, go back one slide. So this slide, typically we would see all of our facilities, all of our hospitals, and Memorial Healthcare System is a 6-hospital healthcare system in Broward County. That's the southeast of Florida, which I'll cover there in a moment. But I think, again, important to note here, typically we have 6 hospitals on this slide, and I recently swapped this out with our marketing team. Obviously, we're all in healthcare, and instead of talking about our bricks and mortar and facilities, we decided we really want to start talking more about our people. Obviously, we're all in the people business. We take care of people all day long, So you can see some really, hopefully great pictures that you all will resonate with you, and certainly all that you have in this last year dealt with the pandemic. And I'll only comment on one last point on this slide. That bottom right-hand corner is Lotsie Dotsie. Lotsie is our resident clown at the Joe DiMaggio Children's Hospital. She's been a fixture here for a very long time, and we love her, and certainly she provides a lot of humor and help to healing all the children that come to Joe DiMaggio. Our mission is to heal the mind, body, and spirit of those we touch. Rather simple in words and really complex to deliver. Probably, again, very similar to many of what you guys all do at your healthcare systems. So I won't belabor our mission or our vision, but I think it's always important to start there. The next slide, Jesus, provides a little bit of a eye chart and diagram of the southeast of Florida. So like I said, Memorial Healthcare System's position sandwiched between Miami-Dade County and the Palm Beaches. So we have 6 acute care hospitals, actually 5 acute care hospitals and 1 children's hospital, going from east to west. So we really start, our flagship hospital is in Hollywood, and we go all the way west to Miramar, which really butts up against the Everglades. In the recent years, and based on our charter, we really had to stay within the boundaries of the South Broward District. And formerly, Memorial Healthcare System is the South Broward Hospital District, so county-based. As you can see on this chart, we actually have expanded into the Palm Beaches and some other areas, and we see a lot of growth opportunity for us in the near term. So our next slide talks a little bit more specifically about who we are and what, some of our accolades and how big we are. So we're 14,000 employees. We have 2,000 physicians or thereabout on our medical staff. We're a little unique, probably compared to many of you, with regard to our physician makeup of our employed base. We have 305 employed physicians, mostly specialists. So we don't have a large footprint on the primary care side, but we do have 9 primary care centers and growing and looking to expand our primary care strategies a great deal this next year and 2 beyond. So we are a level 1 trauma center. We have all the complexities of a big academic medical center. We're about $2.5 billion in revenue. And for Florida, that's sizable. We're certainly one of the largest public healthcare systems in the country. And we enjoy a nice market share. We deliver more babies in South Florida than anyone else in Broward County. So the next slide gets to the problem and what we were really looking at with our hand hygiene compliance. Now, as you all know, probably not one of the most sexiest conversations to be having, but something that's so real and something that we all need to attack as an industry is hospital-acquired infections. We believe, and probably most of you believe, that safety and quality is really the most important aspect of what we do in healthcare. And certainly we believe at Memorial that we are a very safe and a high quality driven healthcare system with patient family centered care as our really core tenet. However, when we started looking at data, and data means a lot, as we all know, and we saw that HAIs were still a problem and continue to be a problem, we really had to figure out a way to attack that issue. And although direct observation for monitoring hand hygiene compliance is consuming and resource intensive, we really said, what are options out there in the industry that help us relieve that pressure on resources? And we know that direct observation or visual observation is not a great science. So if we could look at automated solutions to help facilitate that, that was our goal in a lot of respects. So looking for a tool to perform on-demand infection control and contact tracing was also a major issue and problem that we were trying to address. Certainly in the face of COVID, and even before COVID and well after COVID, we need to look at contact tracing as part of the strategies to, again, attack HAIs. And as I said, HAIs continue to be a problem. You can see that chart in the right corner there These are my hospitals, and I don't mind sharing it. I did take the names of the hospitals out, but as you can see, we've done really well in certain areas for certain disease or infections. And we've done not so well in other areas. And even between our hospitals, there's a problem at most of my hospitals in some cases. So again, that was the problem we were trying to address. I'm going to ask Jesus if there's any other comment on this slide. And if not, we'll move to the next one.
Yeah, so just great intro, and just to supplement these three areas a little bit more, direct observation, like you mentioned, Jeff, is very labor intensive. It's a little bit of old-fashioned methodology of how to collect hand hygiene compliance by direct observation, and it's very limited in the data. Leapfrog currently requires 200 observations per unit per month. And I can tell you, within our hospital, we sometimes struggle to meet that, right? Because it's a very labor-intensive process. Having near real-time data, which intelligent observation provides us to perform contact and/or infection tracing, is going to be key for us in the future as we tackle care delivery practices. And again, hospital-acquired infections. Literature shows time and time again that effective hand washing has the greatest potential of reducing hospital-acquired infections. And having this data in the form of a dashboard at our fingertips is going to equip us best to make those decisions and really learn the practices of our healthcare team.
Thanks, Jesus. So going on to the next slide, and we covered a lot of these points already, but again, just in the face of COVID, and we know the way to decrease HAIs, as Jesus just mentioned, is really hand hygiene, and putting in compliance measures was really important to us. The direct observation practices of hand hygiene only capture a fraction of the events. So we know that Leapfrog just recently moved from this idea that you need 20 observations per unit per month to 200, but still 200 events per month through visual or direct observation is still a small number of the total volume that we could potentially capture. And we'll talk about the data and where we are today in a moment. So the bottom line was also really looking at the resource intensity here. The idea that we all have individuals on our units day in and day out, clinical expertise doing this very administrative function, if we could relieve that burden and put those people to deliver care and create an automated process, we're relieving a tremendous amount of burden on our resources. Now, it doesn't sound like a lot, one person, but if you extrapolate that further between our units and between our hospitals, it's a number of clinical care folks that actually we can help relieve this responsibility for, so that they can be delivering care in really this very challenging time that we're all in, and in the future. So the next slide, Jesus. So we have over the years looked at multiple monitoring solutions, and the challenge has been for us that the lift to do that has been both expensive and intensive from an IT standpoint. And so we really have been ultimately looking for a solution that can provide not only metric-based opportunities so that we can really narrow in on where infections are happening and how we can combat them, but perform contract tracing, as I just mentioned, and then finding a solution that's cost-effective. And finding a solution that's cost-effective has been prohibitive for a very long time, up until now. And so I'm really proud of what we're able to do and talk about our solution next. So the partnership that we've embarked upon here with Intelligent Observation, we were introduced to Intelligent Observation and Seth Friedman, who you'll hear from in a moment, last summer. And their solution is really terrific and really satisfying all the needs that we've been talking about relative to hand hygiene compliance, infection tracing, simple to install. So the lift, frankly, for me and my IT staff has been very little, very easy. And most importantly, maybe not most importantly, the most important aspect is really that we're ultimately using data to reduce infections. But if we can do that in a way that's affordable, that's kind of icing on the cake. So we've embarked upon this at our Joe DiMaggio Children's Hospital for two reasons. One, our CEO at Joe DiMaggio is very innovative, and she likes to be out in front of these sort of solutions. And so she's really a great test bed to get these sort of opportunities flowing. The second reason, as many of you guys can understand and relate to, children's hospitals have not been as impacted during this last year with COVID. They just, thankfully have not. And so the distraction that we have at our acute care hospitals, I really couldn't take that leap and say, let's put in a new innovative solution like this. I'd rather start this at the children's hospital where we have innovative solution. It's a little more modern of a facility. And, again, the face of COVID, the distraction wasn't there. And it's been a great opportunity for us to test out the equipment, to prove out the case study here. And we have a plan now throughout this year to roll this out to my 5 other acute care hospitals. Things are, hopefully everyone's feeling this, things are getting a little bit better. And certainly through the vaccination programs, we're all able to breathe a little bit better these days. We're not out of the woods, no doubt. And that's why we're going to give ourselves a year to roll this out throughout the rest of our facilities. But again, that rollout, that technology lift has been really not a burden on my team as much as it has been on Intelligent Observation to make that all happen for us. And we're very appreciative of that. So Jesus is going to walk through the process a little bit further right now.
Yeah, thank you, Jeff. So one thing I'll start off by saying, in the process from the beginning, in addition to, forming a partnership, seeing the tools they had available that are going to benefit us at Joe DiMaggio and I largely at Memorial Healthcare System, the Intelligent Observation team, the entire team made an effort to really learn our culture, learn what our needs are. And they met our clinical leaders where they are. And what that looked like was scheduling multiple meetings to make sure that they were informed, knowledgeable, and comfortable with the technology that was going to be adopted. They provided informational sessions to make sure all care team members, not just leadership at the top, but all care team members down to the unit nurses, able to attend these sessions. We recorded them, we shared them, again, sending a unified message to all individuals so that everybody's on the same page and they know the why behind this. Communication was seamless. Everybody was hearing the same message. Equally important, the IO team reviewed what our current standards, compliance standards were, and what metrics we were collecting. And they were able to formulate a solution that met that need. And why that's so important is that, and especially in the COVID era, we don't need another go live. We don't need something else to put on our clinical team's plate. And I can tell you that this process so far has been very refreshing because this did not feel like another go live. As Jeff mentioned earlier, the IO team has done most of the lift in terms of installation, badge provisioning, and such. And it's really kind of left us out of the picture. Our contributions have been dialogue, have been education, collaboration. But the heavy lifting has definitely been on the part of the IO team, and that's very important because that's enabled us to go live in areas where the clinical staff have had to do little to nothing except receive some information, go about their day, and that's been so important in the success of this project so far. And again, highlighting that the compliance standards, which we utilize the 5 moments of hand hygiene observation data collection at Joe DiMaggio, they were able to offer that solution with their tools. So we'll go on to the next step here. And I'll hand it over to Seth now, who's going to talk about the solution. So you're on mute, Seth.
If I had $1 for every time, ... Good afternoon, everybody. I'm Seth Friedman. I'm the CEO of Intelligent Observation. Jeff and Jesus, thank you very much. I appreciate not just the kind words and the warm introduction, but very much the relationship that's been formed between Memorial Health System and Intelligent Observation. You guys have been fantastic partners to work with. So thank you both, to you and your respective teams. Very quickly, I wanted to give everybody a bit of an overview of what is so unique and different about Intelligent Observation. I think quite a few of you on this call may have some experience with electronic hand hygiene monitoring solutions. They've been in the marketplace now for some of them almost 10 years. You may have trialed, piloted, received a presentation, done a review on electronic hand hygiene monitoring solutions in the past. I can assure you, IO, what we effectively refer to intelligent observation as, is very, very different. And it starts with the technology that we use. Traditionally, electronic hand hygiene monitoring is done through RFID, radio frequency identification solutions, usually asset tracking solutions at their core that also have some sort of hand hygiene bolt-on module. And they use radio frequency identification technologies. We actually built a system off of something called near field magnetic induction, or NFMI. Although you may not be familiar with the term, I am certain everybody on this call is familiar with the technology. The most common use is the one you see on the screen. It's used in the automotive industry for key fobs and push button ignition cars. It's the technology that allows you to put that key fob in your pocket or your purse, get inside the car, hit the start button, and the car starts. But when you get out of the car with that key fob in your pocket or your purse, even if you're standing right next to the car, someone inside the car pushes the start button and the car doesn't start. At its core, near field magnetic induction is centimeter level proximity detection technology. Centimeter level proximity detection. And there are a number of other physical attributes around NFMI that make it the perfect technology for this particular use case. Secondly, the frequency at which devices communicate across NFMI actually passes through water, passes through liquid. It's a really important aspect. When you put a device on a healthcare worker and you're monitoring their hand hygiene compliance, our bodies are 50, 60% plus liquid. So traditional RFID frequencies, which are absorbed by water, create lots of inaccuracies that we can overcome with this particular technology as it relates to putting a device on a healthcare worker and monitoring their hand hygiene compliance. Additionally, this is what's considered ultra low power technology. To give you a perspective, NFMI is less than 1/5 the power of Bluetooth. So we've been able to develop a solution using primarily battery operated technology that lasts for multi-years in terms of battery life. And lastly, and to Jeff's point, I think you said maybe the most important, then you corrected yourself, Jeff. I think actually you may have been onto something before you corrected yourself. Maybe the most important is that we've been able through this technology to develop a solution that is extraordinarily cost effective. It is equal to, or in some cases less than, the cost that you're visually observing staff. But we provide a whole host of options and actionable data that you don't get from direct observation. Jesus, will you go forward for me? Thank you. Very high level, intelligent observation is a combination of proprietary hardware, software, and algorithms that we've developed. And the solution uses, as I mentioned on the left-hand side of the screen, a small wearable device. It's basically a traditional lanyard, retractable lanyard that a hospital-issued ID would clip on the bottom of, has a small box on top of it that contains the near-field magnetic induction technology. And that device, worn by a healthcare worker, interacts with primarily battery-operated sensors that we strategically place around a hospital environment. And we place those to mimic whatever your facility's current hand hygiene compliance standard is. So if your current standard is foam in, foam out, entry and exit to a patient's room, we'll set up sensors to match that configuration. If it's the more advanced and more detailed WHO 5 moments of hand hygiene, we have the ability to put a sensor and create a zone around a patient's bed to collect data for that particular compliance standard. The real takeaway is that NFMI technology allows us to monitor every single interaction between a healthcare worker and a patient to determine whether compliant hand hygiene according to your facility standard has been met or not, and to report that data in a really unique way to cloud-based dashboard solution. I think one really important takeaway for intelligent observation is that we do not utilize any facility infrastructure at all to backhaul data. So we do it through a cellular technology. It's a small box we place at each nurse's station. Why is that important? Number one, it means we can tell you with 100% confidence, you will never have a data breach or any security concerns around our solution because we don't touch your system. We don't touch your electronic health record. We don't touch any of your IT infrastructure. And two, as Jeff pointed out, it means we're not going to require any ongoing support from your IT department. Zero, really. ongoing support that's required. And the real core of what we provide isn't necessarily the data collection technology I talked about, it's the data that's presented. Intelligent observation allows your patient safety group, your infection prevention group, your leadership team to see hand hygiene compliance, not just across your facility, but by units within your facility, by defined roles, even down to the individual healthcare worker, if you want to look at data that way. Very granular, very actionable data. For Joe DiMaggio Children's Hospital, to give you an idea of what kind of data is collected in the volume of data, as Jesus was mentioning, before IO, they were looking at 200 direct observations per unit per month, a leapfrog standard, very labor intensive with staff, current clinical staff being used. With intelligent observation, they're getting more than 30 times that amount of data, 6,000 plus observations that are completely effortless for their staff per unit per month. And I think one of the really unique aspects of our solution, I'm going to tie it up with this particular slide, my last slide, is that we have the ability to look at hand hygiene compliance in a really unique way. When it comes to hand washing with soap and water, for example, before IO with direct observation, very limited monitoring of soap and water activity. With intelligent observation, Joe DiMaggio sees more than 1,500 unique hand washing events per unit per month, and they can see down to the individual healthcare worker who's compliant, who washes correctly for a full 20 seconds or not. So in summary, IO is a really, we think, accurate, simple to engage, and cost-effective way to manage hand hygiene that's actually never been available before.
Jesus, hopefully your voice is going to come across a little bit more clear right now, but I'll let you wrap us up.
Yes, sir. You got it. So thank you for that, Seth. A great overview. So some lessons learned. The IO team really joined us here at Memorial in adopting a no decision about you, without you approach. And that involved, discussions with leadership and users at every level. And that's really been beneficial. We adopted a phased approach, and that enabled us to have a little bit more calculated effort and really provided a successful go live in the areas. Also, we were able to not only have go live support, but ongoing support. We have an account manager, Cam, who's excellent, in addition to the leadership team at IO that really provides ongoing support on a weekly basis as needed through WebExes and such. So overall, it's been a very seamless effort to go live. And as Seth mentioned, we're collecting thousands of data points that are going to be actionable, meaningful, and accurate across a 24/7 healthcare landscape. So I'll end us there.
Jeff, Seth, and Jesus, thank you very much. Really appreciate the presentation. Very interesting, and enjoyed understanding how Memorial Healthcare System and Intelligent Observation had partnered to launch this solution. We're going to be transitioning now to the members only Q&A session. So for Chime members, you'll see in your calendar invite that there's a separate Zoom link, Zoom meeting link. So please close out of this one and go to that next one. For those that are attending, thank you very much. This is recorded and you'll be able to view it on demand. And I know that there were a couple of questions that we'll get to and send out to everybody. And also, please take a look at our spring forum, which is coming up April 14th and 15th. We've got a really exciting panel that's going to include the CEOs of Epic, Meditech, and Cerner. So thank you once again, everyone. And for members, please close out of this webinar and join us in the Q&A session. Thank you and have a good day.